Hello all, and welcome to the L Show, where the L stands for leaning in. I'm going to stop there and say that this show and its contents may not be suitable for all audiences, because the L in the L Show means, again, that we are leaning in. We're not going to shy away from any of those subjects that are uncomfortable, no matter how taboo they may be. Things like menopause, sex and libido, a dry vagina, hot flashes, mental health and depression, which makes you not want to have sex, how we look and how we feel. I'm your host, Dr. Nicole Eastman, and am the owner of Rose Pharmacy and Boutique Apothecary located here in beautiful Cornelius. We are a compounding pharmacy with a focus on functional medicine and a much more natural approach to your health. And for those who are not familiar with what compounding is where your pharmacist makes medications that are formulated in a specific dose and or in a specific dosage form that is unique to you. And not all compounds or compounding facilities are alike, and quality shows in every aspect of what we do. You can find out more about us by checking us out on our website at roserxboutique.com or on Instagram and Facebook at Rose Pharmacy and Boutique Apothecary. And again, the information presented on this show may not be suitable for all audiences and does not take the place of advice from your health care provider. Happy Friday to all of my viewers and listeners. Now, again, this will be my third time saying that this information may not be suitable for all audiences. Why am I saying this again and again and again? Well, because, be transparent with you guys, I received a phone call at the store, a very unhappy person concerning this show. And I was taken aback a little bit because I typically get positive feedback about the show and the reasons why it's needed. And also because I typically can take constructive criticism, but this was pretty far from it. So I'm going to spare you all the details, but ultimately this show may not be suitable for all audiences and ages, depending upon a person's parental philosophy. And it may just not be someone's cup of tea. Shows that don't appeal to me, I just don't listen to. But if there is something said on the show that motivates a person to search for my pharmacy on the mobile, get the number, call, and wait through all of the prompts to speak with me, I would hope that we could have a respectful conversation, and if nothing else, agree to disagree. Because again, I love to hear everyone's opinion. I want to, and also consider it. You know, maybe there's something that we could do a little bit different. But ultimately, we must be kind to one another, and we must be respectful of one another, no matter what it is we're doing. So I appreciate the calls, appreciate the opinions, but all that I ask, just like I think anyone else would expect, is that we're just kind and respectful to one another. So moving on from there. If you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more, because Rose Pharmacy is the place for you. Quality shows in every aspect of what we do. And if you are taking too many medications, supplements, or both, make sure that you take advantage of our consultation services where we can help you safely solve that issue. And for those of you who have been looking for Wegovy or Ozempic and having trouble finding it and cannot afford the out-of-pocket costs, if you can find it, well, I'm excited to tell you that Rose Pharmacy now offers the weekly injectable semaglutide base, the exact active pharmaceutical ingredient in Wegovy and Ozempic. And this product, which is made in an FDA-registered facility under the same strict standards required of any manufacturing facility. So if you have had any issue with either availability or cost, we now have the solution. So give us a call at 704-255-6172 and allow us to help you get the weight-reducing medication that you need at a fraction of the cost of the brand name. Now, here's some points to consider. With brand name Wegovy, which is injectable semaglutide, the newest FDA-approved indication for use in the reduction of risk of serious heart problems in those people who are either overweight or obese, this is not only going to be an additional strain on product availability, but it is also subjecting more of the population to the unaffordability of this life-saving medication. So as more providers across numerous disciplines are making connections and seeing how this medication can benefit their patient populations, such as a gynecologist using it for patients with POS, since many people with POS have insulin resistance. Or you may find psychiatrists using it for patients whom are taking antipsychotics because the significant weight gain that can occur, which can deter a patient's compliance and therefore go, of course, unhelped. Or even sleep docs using it for sleep apnea because weight loss can improve symptoms of sleep apnea. So as more and more providers alongside their standards of care are tuning into this as a adjunct to their therapy, the problem of availability and cost is going to continue to be an issue. I had someone last week who's on Medicare, and their cardiologist wrote them a script for Wegovy for that newest indication for semaglutide, which is to reduce the risk of serious heart problems in a person who is obese or overweight. They wrote them a script for Wegovy, and they came in and said, listen, my insurance will cover it, but the copay was $800. Now, I've talked about this before. Just because your insurance company says, yes, we will cover it, what they're saying is we will cover a portion of it, and you still are going to have your out-of-pocket, portion. And in this situation, his out-of-pocket contribution was $800. And that is completely unsustainable for many. So I was glad that, he came in, because this is where I'm able to fill in a gap with my injectable semaglutide. So I shared the information with the cardiologist. They ended up sending a script to me, and I was able to, again, fill that prescription for a fraction of the cost. I think, again, as we have more providers writing for this medication, because of all of its benefits, we are going to continue to see the issue of availability, the issue of cost, be a problem that many people will face. And if it's not at my pharmacy, if it's not at my compounding pharmacy, if other compounding pharmacies have the medication, I would just suggest people reach out, because again, you can get it at a fraction of the cost, get all the benefits of the medication without having to possibly not pay a bill. And I have seen that happen where people are having to make those very, very difficult decisions around, am I going to eat or am I going to be able to get my medication? So again, if you are looking for the quality compounding pharmacy in the Lake Norman area, Rose Pharmacy is going to be that place for anyone who is in need of something unique, something off the beaten path, and also things like this where we can come in and help you out with that. So today we have on the show Dr. Josette Giuffrida. She is the owner of Refresh Lake Norman. She has actually been on our show before, but it has been a while. So welcome back to the show, Josette.
Thanks for having me
Of course. And when we get back, we're going to talk about safe procedures over the summer for the skin. And this is a time where people are getting most of their procedures done. And, we have had her on the show and talked about a lot of the aesthetic things that she's done, but she also does many more things, such as hormones. So when we come back, we're going to go through some of those procedures, and then we're going to get into the very interesting topic of hormones. We'll see you on the other side of the break. Thanks. Hello all, and welcome back to the Elle Show. I'm your host, Dr. Nicole Eastman. And if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. And if you are taking too many medications, too many supplements, or both, make sure that you take advantage of our consultation services, where we can help you safely solve that issue. And for those of you who have been looking for Wegovy or Ozempic and have had trouble finding it, and or have had trouble affording the out-of-pocket cost, well, I'm excited to tell you that Rose Pharmacy now offers the weekly injectable semaglutide base, the same active ingredient that is in Wegovy and Ozempic. And this product, which was made in an FDA-registered facility under the same strict standards required of any manufacturing facility, is now available. So if you have had an issue with either availability or cost, we now have the solution. So give us a call at 255-6172 and allow us to help you get the weight-reducing medication that you need at a fraction of the cost of the brand name. So again, like I said, we are in the throes of summer and people are getting many of the skin procedures. And we have, again, with us, Dr. Josette Giuffrida. She's the owner of Refresh Like Norman here in Cornelius. So for those people who are newer to the show, Josette, we know your background, but they don't know your background. So kind of tell us, where you're from, give us an idea of what brought you to being in primary care and then coming to doing your own thing. So go ahead and give us the spiel.
So I've been in healthcare for a really long time, since 1996. Started out as a registered nurse and then became a nurse practitioner and then later pursued my doctorate. So I worked in mainstream healthcare for a number of years, probably almost 20, and had also done some aesthetics on the side for a number of years, and then shortly after COVID, kind of made the full transition to doing the aesthetics, and then saw a need to do some hormone, help people with their hormones. And so it was, a relatively easy transition to doing that full time. To, the goal is always to help people feel their best.
Right. So now I know, so you practiced for a long time. Was there anything, did you feel constrained? Like that's what I find. So many people who transition from the mainstream into what you're doing is because they felt constrained. They felt like they couldn't help people the way that they needed to be helped. Was that your situation as well?
Absolutely. There's always that pressure to do more and provide more and that kind of thing. So, insurance and prior authorizations. I said when I left, I was never, ever going to do prior authorizations again. Of course, I have done a couple, but, not in my preferred state, but it happens. So, yeah. I mean,
All right. So we know that you do some exciting things. One of the things that I really want you to talk to us about is exosomes. Mm-hmm. So what is exosomes? Tell us the benefit, the process, and all of that.
Right. So the latest and the greatest, there's always something new. Before it was PRP, and I'm trying not to get too technical, which is platelet-rich plasma.
I was going to say.
Yeah, we draw your blood, spin it down, and then get that. It's actually gold in color, but it is like gold. Sometimes that's not good if someone has something autoimmune or an illness or something like that. You don't necessarily want to use their own blood. So then comes exosomes, and exosomes come from stem cells, and they are great for rejuvenation and overall health, skin health. They should not be injected. I went to 3 conferences this year on aesthetics and one on hormones. But the focus was not injecting. You can't inject exosomes, whereas PRP you can inject. So, frequently under the eyes, I'll inject platelet-rich plasma for that rejuvenation, because there's, there are some issues with fillers under the eye, and, a lot of people do that and it looks great. There are some risks with that. And, later on, sometimes it moves where you don't want it to go. It's like super thin tissue there. So that's why we lean more towards platelet-rich plasma and that kind of thing. But topically, using exosomes with microneedling, which opens up channels, allows those exosomes to get in there and do their job. But yeah, there's just more and more research demonstrating how great they are and how effective they are. And, there are always advancements as far as like other treatments derived from the research with exosomes.
Exosomes and hair growth. So, when I think of microneedling, I think of automatically I go to the scalp and hair growth. So do we use it also on the scalp?
Absolutely. So we have a certain device that has some energy to it. But we turn off that energy and open up those channels using the microneedling without that energy. And then apply the exosomes. So channels made, and then exosomes go in there and do their job. So yes, it's great. And we have some posts on that. So, and then, sometimes we'll follow up with some compounded topical solutions that they can use it every night. I personally use some. So yes, it's a great treatment, great results. And yeah.
So what about so how often should you be getting, if you were getting exosomes, how often should you be, with microneedling, how often should you be getting it done?
Yeah. So typically once a month for 3 months for the face. And then for hair, it's 5 treatments spaced about a month apart. And then a yearly maintenance of a treatment or 2, not necessarily the whole thing all over again. It's about maintenance. You can't just do one and done.
Right.
I said before how I like things one and done.
Yes.
It's not always that way. Any of the treatments, a lot of the treatments that we do, it's not always one and done. You have to maintain it.
Do a series of it.
Yeah, because you continue to lose your collagen, lose your elastic, lose all the things. So you have to do something to maintain them.
Well, okay, so a shameless plug for me in this situation. So I do sell microneedling devices. So, and of course, this is not the level of what she does in her store, but what we do know is that if maybe from a in between time, if it's once a week, like in my needles, the longest one I have is the 1.5. But oftentimes I will have providers actually write for the hair lotion, and then they will write for microneedle as well.
Right, exactly. Perfect.
So from a maintenance standpoint, again, you can have a microneedling device at home that you can use in between the times that you're getting your exosomes.
Right.
Right?
Exactly.
So, okay, so we know about microneedling with exosomes, but you can also microneedle alone. Is there benefit in doing that? Do you see it?
Absolutely, because we use serums and things that after those channels are opened up, they're applied so that they go deeper into the skin. So great benefits with microneedling.
All right, so let's move on to peels.
Yes.
So what is the best peels for the summer?
Right, so we use VI peel, it's called. And
what's a peel? I'm sorry. Let's start here.
Yeah.
What is a peel?
Yeah. So certain acids that cause a resurfacing of the skin to, you peel, you literally peel. Some people don't peel. And sometimes that can mean that actually their skin is in great shape. But it releases all the negative things. Sometimes people will have a little purge, meaning like a little acne breakout or something like that. And that's okay. That just means you're getting rid of the bad stuff. But peels, there is a misconception that peels are not safe in the summer, but they are. And the VI peel kit actually comes with a sunscreen. So, and that is important. Sunscreen.
Oh, yes. I think that this months ago, I had a picture of a older gentleman who was a truck driver, and the one side of his face that was exposed to the sun versus the other side was just amazingly different, but that is just how bad the sun is for you if you are not protecting it.
Yeah, and a lot of people are like, oh, I'm just running here or there. I'm not going to the pool or anything. You still need sunscreen every day.
Absolutely.
And reapplication is important too.
Right. So people will say, okay, I put it on this morning. Well, you need to reapply as you are out, right? Yeah. So to make sure that you're getting the full benefit. So when we get back from break, we're going to keep on talking about peels and then go into a few other things. So if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. And for those of you who have been looking for Wegovy or Ozempic and have had trouble finding it, and or have had trouble affording the out-of-pocket costs, well, I'm excited to tell you that Rose Pharmacy now offers the weekly injectable semaglutide base, the exact active pharmaceutical ingredient in Wegovy and Ozempic. This product, which was made in an FDA-registered facility under the same strict standards required of any manufacturing facility. So, if you have had an issue with either availability or cost, we now have the solution. So give us a call at 704-255-6172 and allow us to help you get the weight-reducing medication that you need at a fraction of the cost of the brand name. We'd love to hear from you, so please give us a call at the studio, or you can interact with us on social media. Studio number 844-STUDIO-4 or 844-788-3464, or you can put those questions in the social media box. So again, we will see you on the other side of the break with Josette. Hello all, and welcome back to the Elle Show. I'm your host, Dr. Nicole Eastman, and I am here with Dr. Josette Giuffrida. She is the owner of Lake Norman. Sorry, why do I keep on saying, I want to say Lake Norman Refresh. I want to say Refresh Lake Norman here in Cornelius, North Carolina. And if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. And if you're taking too many medications, supplements, or both, make sure that you take advantage of our consultation services, where we can help you safely solve that issue. And for those of you who have been looking for Wegovy or Ozempic and have had trouble finding it, or have had trouble affording the out-of-pocket cost, I'm excited to tell you that Rose Pharmacy now offers the weekly injectable semaglutide base, which is the exact active pharmaceutical ingredient in Wegovy and Ozempic. This product, made in an FDA-registered facility under the same strict standards required of any manufacturing facility, is now available. So if you have had an issue with either that availability or the cost, we now have the solution. Give us a call at 704-255-6172 and allow us to help you get the weight-reducing medication that you need at a fraction of the cost of the brand name. And I will say this too, you have to have your provider's involvement. So you just can't walk into the store and say, I want it. We need to make sure that your provider is involved, because they have to write you the script. So I'll say that, because I have had someone come in and say, oh, I want it. Like, well, we got to get your doctor involved. So again, just put that out there. So again, we have with us Dr. Josette Giuffrida. She is with Refresh Lake Norman here in Cornelius. And we are talking about safe things that you can do for the skin, and also kind of dispelling myths about what you can do in the summer, what you can't do in the summer. So we know during the summer, as she said before we went to break, you can do peels. So that is a safe procedure. It's important that you do sunscreen. Okay, sunscreen.
Yes,
right?
100%.
So let's talk about just a few different types of peels that you're seeing that people are getting most often.
Absolutely. So sometimes there's issues with like melasma, pigmentation, acne, and a lot of times we'll say, let's start with a peel. We can kind of peel off the layer and then see what we're dealing with, because we've got all the lasers, all the things, so that, once we get to see what we need to work on even better, then that helps with that. But, I talked before about like the purge and that kind of thing. So there's certain peels that can focus on acne, certain ones that we use to address pigment. In the summertime, melasma comes out a lot. It's hot. It's making it flare up. So yes, we can, focus on your needs. There's specific peels for specific issues. And, everyone's kind of afraid of lasers during the summer. Well, think of California, Florida. It's always laser season.
Yeah. Okay.
So it's important to know that someone like me, I'm able to do lasers in the summer, because I, run from the sun. Of course, I need my vitamin D and all that good stuff. Right. But there's always a need for a laser. And if you can't be out of the sun, you have a boat, you're out there all the time, you're going to get exposed.
We are at the lake, right? So,
but still, there are we have people who come in, they're like, yeah, I don't go in the sun. I will wear my hat. I don't have I don't go out in the lake. We're all good. So yes. And then again, sunscreen.
People just don't understand the importance of the sunscreen. And you think you pay for this procedure. Why not protect your investment?
We say that all the time.
Yes, protect your investment. And you'll people will, have a break. I've had someone have a procedure come in a week or so later and they're like, oh my gosh, my skin is just kind of flared up. And I'm like, well, were you using sunscreen? Well, not really.
Right.
Okay, well, that's, the issue. You've got to protect what you just paid for.
Yeah, exactly.
Right?
All year long. Even in the winter, there's still sunlight.
There's still UV.
Yeah.
People just don't understand. So listen, people, sunscreen, sunscreen. Okay, we know the ever popular Botox.
Yes.
So talk to us about Botox.
Botox.
I'm afraid
fillers.
listen, I've gotten it once just because I wanted to have the experience.
Right.
This dermatologist said, I want you to know what it feels like. It wasn't bad, but I was always afraid of it.
Right.
Because of all of the, botulinum toxin.
Yeah.
But, great. So tell us about this.
It's actually, I'm going to get too complicated, but just for a second, it's actually the purified protein derivative. So we're not taking an illness and injecting it into you.
Yes.
They just recently celebrated their 20-year in existence. And aside from, doing it for cosmetic reasons, there's medical reasons and some of the other, it's not all Botox, we'll say tox in general. Some of them have other indications, medical indications. So, overall, great thing, lots of research, lots of years of use. But as far as in my place, we do it aesthetically. Sometimes we'll do hyperhidrosis, like,
excessive sweating.
Yes, yep. But yes, and there's misconceptions. Is my face going to look like, I went through a wind tunnel or whatever the case? No. No, it's strategically placed. You follow up. Sometimes in the beginning stages, you may feel a little like, oh, I can move this, I can't move that, but it usually levels off in a couple weeks. So yeah, it's a great service. It's kind of the gateway to other procedures. And I see newbies all the time, and it's fun. It's great. A lot of people have been scared of it for a long time. But you got to start somewhere. And, sometimes if we do just one area and then they're like, okay, yeah, let's go and do the rest. So
just explain to us, though, Botox is a brand. And
Yes.
there are other brands
Yes.
that have the same thing. So there is Xeomin. Is that the name of it? If I'm now, is that
Can I say them all?
Yes,
Okay.
absolutely.
So there's Botox, Xeomin, Jeuveau, Dysport, and Daxxify. And they have the same mechanism of action. The way they work is the same. But something is a little different about the molecules. For example, Daxi is bound in a positively charged peptide. See how complicated that gets? And it's considered vegan. There's different things about these. So a lot of people are like, oh yeah, I got my Botox. And it's not necessarily Botox you're getting. You may be getting one of the other brands. All great and work well, work differently in some people. So if someone is offering you Botox at a super low rate, you might want to make sure that that's what it is. And, you have to buy from the company that manufactures it. And actually, I spoke to someone, back a few months ago, there was some scare with not legitimate Botox used by non-legitimate injectors. So that's a concern. I did my due diligence and I called the rep and I was like, what's the story? And he's like, yeah, it was, not the real stuff. And I was like, yeah, I know that. I figured that. I just wanted to make sure I do my due diligence. And so it actually comes with armed guards from, I believe it's Sweden, with armed guards protecting it. Yep. So yeah.
Wow.
Make sure your provider is giving you the real stuff, and
yes,
ask for the name, see the bottle, any of those things. And if anyone doesn't want to show you,
don't do it.
Yeah, don't do it.
Well, more on that on our next segment. So if you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you, where quality shows in every aspect of what we do. And if you're taking too many medications, supplements, or both, make sure that you take advantage of our consultation services where we can help you safely solve that issue. And for those of you who have been looking for Wegovy or Ozempic and have had trouble finding it, or have had trouble affording the out-of-pocket cost, I'm excited to tell you that Rose Pharmacy now offers the weekly injectable semaglutide base, which is the exact active pharmaceutical ingredient in Wegovy and Ozempic. This is made in an FDA-registered facility under the same strict standards required of any manufacturing facility. So if you've had an issue with either availability or cost, we now have the solution. Give us a call at 704-255-6172 and allow us to help you get the weight-reducing medication that you need at a fraction of the cost of the brand name. See you on the other side of the break.
Was that okay? I was trying to like...
Welcome back to the Elle Show. I'm your host, Dr. Nicole Eastman. If you or your healthcare provider has been looking for a quality compounding pharmacy in the Lake Norman area, look no more. Rose Pharmacy is the place for you. The quality shows in every aspect of what we do. And if you are taking too many medications, supplements, or both, make sure that you take advantage of our consultation services where we can help you safely solve that issue. And for those of you who have been looking for Wegovy or Ozempic and have had trouble finding it and or have had trouble affording the out-of-pocket cost, I'm excited to tell you that Rose Pharmacy now offers the weekly injectable semaglutide base, the exact active pharmaceutical ingredient in Wegovy and Ozempic. This is made in an FDA-registered facility under the same strict standards required of any manufacturing facility. So if you have had the issue with either availability or cost, we now have the solution. Give us a call at 704-255-6172 and allow us to help you get the weight-reducing medication that you need at a fraction of the cost of the brand name. Now, we are back with Dr. Josette Giuffrida. She is the owner of Refresh Medical Spa and Wellness here in Cornelius, North Carolina. So we were talking about Botox and its other brand names and also the dangers that can come with getting something that's not Botox, not the real thing. So let's continue along those lines. And then we want to get to fillers because that's a huge one as well.
Yes.
Okay.
So not all tox is the same. Ask for the brand name. You may think you're getting something that you're not. And yeah, I show people all the time on the bottle of one of them, there's a little hologram on there, so you can actually look at it, make sure it's legitimate. And if anyone has any issue showing you or, demonstrating or showing you the box, I don't know. I think the counterfeit or not counterfeit, but the ones from different
the fake
countries. Yeah. The fake ones, they might do a pretty good job at that, but you must, as a provider, you have to, order specifically from the company, make sure that hologram's on there. There's lot numbers, expiration dates, and we reconstitute it. We don't dilute it. We reconstitute it, which means we mix it with a certain amount of saline and So it's all legitimate. But if anyone ever, says, "Oh, no, that wasn't Botox, that was Jeuveau," all great products, but just make sure you know what you're getting because there's different costs to them as well for the, provider. So, just be aware of that.
Thank you for that.
Yeah.
Yeah. So fillers.
Oh,
how do you listen? How do you do fillers? I see fillers and it's too. How do you do fillers and not look fake?
Yeah. So I'm known for being pretty conservative around here. I will not let you leave my place with lips that look like the common things I hear are, I don't want to have duck lips and I don't want to look like I have big apples in my cheeks. But like the basics as far as fillers go, cheeks, lips, and chin. So we used to inject like these lines right here, the nasolabial folds, all day long. That was like one of the indications back in the day. And it's overall, balancing, facial balancing. You'll hear that a lot. But yes, I am on the conservative side. So you're not going to leave my place looking like a duck. So, but you do need to understand, a syringe is 1 ml. 1 ml is a fifth of a teaspoon, a tiny amount. So if you're like, I need some filler here, 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 we don't inject up here. I don't do noses either. A lot of providers don't do noses anymore. There's only so much that we can do with a fifth of a teaspoon. So,
well, I am like, wow. I mean, the duck lips thing.
Yeah.
And I think that it's good that you tell people, listen, no, I'm going to be a little more conservative. But what about like refilling?
Yeah.
Refilling. How does that work? Like, do people just come back after a few months and say, oh, I want more? Or does it go down after, you know what I mean? So what's that look like?
Initially there's some inflammation and that kind of thing. But over time, the body does reabsorb it. However, sometimes, people come in and they'll want their lips done, but you can tell that there's old filler in there. Optimally, you would let me dissolve what I need to dissolve, because yes, filler can be dissolved. You would let me dissolve it if we need to, and then kind of start over. But other people, it's completely reabsorbed after 6 or 12 months, and then we can re-inject. So there's another favorite of mine, and it's called Sculptra, which
I was going to ask about Sculptra.
Yep, it's different than a filler. It's PLLA. See, I get really complicated.
What does PLLA stand for?
Poly-L-lactic acid. So It is, did I say that right? It might be. It's a little early in the morning, so just PLLA. That's what you need to know. It is reconstituted with sterile water and then injected under the skin, so it stimulates your own collagen. So you're not going to have that immediate filler face, I call it. You'll be a little inflamed and that kind of thing, but so the collagen is getting stimulated. It can take 3 months to see results. It needs a couple treatments sometimes, but it is just one of those slow progression. But the results can last up to 25 months, they say, and that is said because it was studied up to 25 months. They couldn't study
it longer than that.
Right,
that makes sense.
Right. So, but 25 months for a
that's
product. Yeah,
that's amazing.
Yeah.
Wow. Okay, so Sculptra. Well, so I don't want to run out of time because we want to talk about hormones.
Yes.
What people don't know is that you also do hormones.
I know a lot of people don't know that.
Yeah, they don't know that. And I always say, when we think about anti-aging and some of these procedures and whatnot, like typically anti-aging and hormones to me go hand in hand. So let's talk through just a few pieces with your hormone balancing. So tell me, what are you seeing? Like most of the time when somebody walks in, how do you identify that patient that may need, that you're going to look at their hormones?
Right. They'll have the major complaints of weight gain is probably number 1, maybe number 2, hot flashes, decreased libido, lack of vaginal moisture, joint pain, fogginess is another one. So all the things, and changes in their skin texture and their hair, you name it, it happens with hormones.
So what's your approach to that patient?
So, we sit down, we have a talk, we review their history, make sure that they're a good candidate for that. And then we talk about labs and check their labs. A lot of times you can kind of tell what's going to be low. Some pretty much, if it's a certain time and you haven't, had a period in 5 years, you're probably not going to have much estrogen, progesterone, or testosterone. And so we check their blood work, and then afterwards we discuss the best treatment, and then I send in a prescription. Typically, it could be a combination. There's topicals, there's pellets, all those things. But then my prescriptions, and then the patient sees Dr. Eastman, and then we definitely collaborate and make sure that we're doing the right thing for the patient, making sure that their dose is good and that they're feeling better. So, then I follow up, make sure we're good. There's a lot of tweaking that goes on. A lot of sometimes people think instant.
Yes, that's right, and that's just not the case.
No, and that can be a little frustrating for both of us. I try and educate and say, this is a process. Your hormones didn't go away overnight, so it's a process to get them back and to make sure, it's all about customizing the treatment to the patient. So making sure that they're on the right dose and the right medication. And, some people don't respond the same way to some,
correct,
certain prescriptions. So it's all about balance and patience, and communication is key.
And I will say that, like when someone is picking up a compound from me for a hormonal prescription that you've written, I will reiterate that, again, it just didn't happen overnight. So this is really a process. Start low, go slow.
Yes.
Right. And then, you're in their follow-ups, when you're redrawing labs, we're trying to see based upon how you feel and a number. So it's not just a number, but
right.
It's also how you feel. That may take some time. But people want the instant results of, oh my gosh, the weight gain that I've had, the little tire around my waist that now I can't get rid of.
Right.
I want it gone in a month.
Yeah.
And if not, then I'm just this is just not working.
Right.
It's not how
this goes. I feel like a lot of times it's, we get a month. And then we're done.
Give us a month. Yes.
It definitely takes time. And, talking about lab draws and that kind of thing, there's a lot of discussion amongst providers as far as what's the best way to retest. Saliva versus finger prick versus serum, which is like a blood draw. There's different ways to test, and some things are not detected in serum. Some things are over detected in saliva, and we just kind of. I tell the patient frequently, we have to dose based on you. I can't necessarily dose everything based on your labs.
So where can people find out more about you?
refreshlkn.com, at refresh_LKN on Insta, and then Facebook, Refresh Medical Spa and Wellness.
Well, thank you for being back on the show. We have enjoyed having you. We're going to do this again, much sooner than later. Thank you to everyone who has tuned into this week's segment of the Elle Show, and a big thanks to Josette. And again, I hope your time with us today was informative and helpful. I'm your host, Dr. Nicole Eastman, pharmacist and owner of Rose Pharmacy and Boutique Apothecary here in Cornelius. Ladies, block off that 3 to 4 p.m. time slot every Friday for the Elle Show, because I want this to be our happy hour, wrapping up a very busy week together on an uplifting note. See you next time. Take care.